Now, so far we've talked about bone growth in terms of increases in bone length, but we also obviously recognize that the bone is increasing in size, in width. And we can measure this by looking at the cross-sectional area. So if you can visualize, we're taking essentially a slice from the mid-region of the bone, and we're looking at the cross-sectional area. And as the broiler grows, what we see is not only an increase in mineralization in terms of cortical bone density, but we see a substantial increase in bone cross-sectional area. So bones are growing rapidly in length, but they're also growing more rapidly in cross-sectional area. And it amounts to about a 30-fold increase between hatch and 6 weeks of age. When we look at broiler breeders, we see that the overall cross-sectional area is smaller than in broilers. And this is interesting because typically broiler breeders are going to be heavier than broilers, but that slower growth rate changes how the bone is deposited. Now, if we look at early in life, if we look at bone formation, we have a situation where the bone cross-section is essentially a circle. We have the outer region, or the periosteum region. We have the cortex of the bone, and then we have the marrow cavity. Normal bone formation normally proceeds along canals that are deposited in the bone, and these canals gradually become mineralized. And with slow growth rate, we have the deposition of calcium into these canals, these Haversian canals, and these form osteons. And these are the basic structure of the bone. With rapid growth rate in the broilers, however, we have to think of bone as a structural material. And when we look at bone as a structural material, what we see is that the bone is stronger when there's a dramatic increase in the outer diameter of the bone, even at the expense of not filling in all those canals, all those osteons. And so in broilers, what we get is typically a porous bone surface. Now we have to remember that we market broilers at 6 weeks of age approximately, and in some markets even earlier than that, and the bone is an immature structure. We're marketing these birds at a very young age. If we consider that sexual maturity occurs at about 25 weeks of age, we are marketing these birds at a very, very young age. And so this porosity is a function of the very rapid growth rate of modern broilers. And as long as we are going to market birds at such young ages relative to sexual maturity, we're probably going to have to deal with this bone porosity issue. If we were to allow broilers to achieve a more mature body weight, or if we look at broiler breeders, what we see is that over time, these canals become filled in and we have a much more solid structure. And so this explains the higher cortical bone density that we saw in the previous slide. So again, it's important to underline that the bone development of broilers is really a function of the age at which we market birds. So we are marketing immature birds. It's unreasonable to expect them to have a mature bone structure. Now in the past, the rapid growth rate greatly increased the risk of skeletal deformities. In the 80s and 90s, again, skeletal problems were a big issue. We saw the emergence of lighting programs and feeding programs that were essentially designed to slow down early growth rate in order to reduce bone deformities such as tibial dyschondroplasia, angular deformities, and a number of other bone problems. I think the primary breeders have done an excellent job recently of selecting not only for rapid growth rate, for breast meat yield, and for efficiency, but they've also paid a lot of attention to skeletal health and metabolic health, and I think that has certainly had a positive effect on the skeletal health of modern broiler chickens. However, as we continue to select birds for more rapid growth, we have to remember that we are still dealing with an immature bird, and as the birds grow faster, that immaturity or that relative immaturity is likely to increase at market weight.